How do flu strains impact potential complications? Imagine catching the flu and wondering how serious it might get. The answer depends a lot on which flu strain is causing your illness. Different strains can lead to different levels of severity and risk of complications. Influenza viruses are mainly divided into two types called A and B. Both cause seasonal outbreaks, but they don't affect everyone the same way. Influenza viruses tend to be more aggressive. They often cause more severe symptoms and are linked to higher chances of complications. Within influenza A, there are subtypes like A, H1N1 PDM09, and A H3N2. The A H1N1 PDM09 strain, which caused the 2009 pandemic, has been associated with more serious health issues. Patients infected with this strain are more likely to need intensive care, requiring machines to help them breathe, or even need advanced life support measures. They also tend to have higher chances of dying from the illness compared to those with H3N2. Influenza B viruses are generally less aggressive but can still cause serious problems, especially in children under 5 and older adults. While they tend to cause milder illness than some influenza strains, they can still lead to complications like hospitalization, severe respiratory issues, or even death in vulnerable groups. Both influenza A and B cause similar symptoms like fever, muscle aches, fatigue, cough, and sore throat, but the risk of complications depends on the specific strain, age, and overall health of the person. Research shows that the severity of illness isn't just about the strain itself. Factors like age, existing health conditions, and immune system strength play a big role. For example, the AH1N1 PDM09 strain has been linked to a higher risk of secondary bacterial pneumonia, which is a serious lung infection that can follow the flu. It also increases the likelihood of needing intensive care or facing life-threatening outcomes. Knowing which flu strain is circulating helps doctors predict how severe the flu might be and decide on the best treatment options. Vaccination is a key tool in prevention because flu vaccines are designed to protect against multiple strains of influenza A and B. Vaccination can significantly reduce the risk of severe illness and complications, especially in high-risk groups. In summary, the impact of flu strains on potential complications varies. The AH1N1 PDM09 strain tends to cause more severe illness and higher risks of serious complications than AH3N2 or influenza B. However, even influenza B can cause serious health problems, especially in young children and the elderly. The overall risk depends on the virus strain, the person's age, and their health status. Always consult healthcare professionals for personalized advice and treatment options.